Good morning, everybody. As you guys get on, will you just make sure everybody's muted? And I'm just letting everybody in. So it's always hard when we're doing these assessment videos because I got to let everybody in too. So bear with me. So guys, when you come on, just check and make sure you're muted. All right, you ready, Shana? Okie dokie here. All right, well, welcome. Everybody's hiding from me today. Betty, you're the only one I can see. Can you hear me? Okay, cool. All right, a couple more people coming in here. This is Shannon. Many of you already know her, and she is going to be our postural assessment person. So I am going to have to fiddle around, and this is, here, let's get this so you can see me here. Just like in real life, this is going to be very imperfect doing this virtually. So what we're going to show you can be done virtually or in person. Obviously, being able to do it in person has its advantages, but we found this to be very effective and have been doing this since COVID started. But you're going to have your client move their, hold on, got to keep letting people in, move their computer around. So sometimes it's helpful if you're doing a virtual assessment to actually ask your client to have, you know, somebody there with them. So if they're holding their phone or they're holding their computer, they can actually move around because they're gonna have to look at their upper body. As you're coming on, make sure you're muted, please, just so we don't get any background noise. And for those of you who are just jumping in here, what I was saying is when you're doing a virtual assessment, it's going to be really important. I mean, your client can spend time doing the assessment and going or move their phone. If they actually have somebody there that can kind of adjust the computer screen or their phone accordingly, that way you can just keep moving forward with your postural assessment. Otherwise, it's just a few extra steps. But it is doable. So Barb Hyde says hello. That's not for today. Come on over here. All right. So we tried to find the, and as you see, we can't get far enough away to get all of her, or there we go. Try and get as blank a wall as possible. It's not always going to be perfect, especially if you're asking your client to do this. You know, they may not have a wide open wall like this. So we moved around some furniture. And hopefully it'll be pretty easy to see. The lighting's pretty good. We've got a lot of windows here. I always want my client to start off barefoot. That way, if they have any orthotics or lifts or anything in their shoe that is going to alter their posture, we do away with that. So we are seeing them true as they stand. And I give them cues. For example, like don't try and stand like a soldier. Don't try and stand perfectly erect. Just be you. So some people do this dynamically, having their clients walk first and actually, you know, looking at their gait, and that can certainly be done, but it's difficult, especially virtually, because we don't have the same amount of space, and your view of the person may be thwarted, you know, if they can't walk in a straight line, if they're walking around the room or something. So I would save that for in person. So what I'm going to do is just have her march in place. Now, although I'm going to be doing this with you, if you guys could real quick take a second and in the chat box, write yes or no. Have you done postural assessments before? Because this will be really helpful to me as to guiding you. So just yes or no. Have you done them? Have you not done them? Okay, kind of got every other person. All right. Well, for those of you who have not been doing them, this is definitely probably the best tool in your arsenal. And this along with you know, the modified Thomas test, the squat test, all of these things that we can use together, because we might see some things with her standing, you know, doing the postural assessment, but we're like, all right, I'm not really sure what's causing that. And then we do the modified Thomas test also, and we can narrow it down to, okay, this is tight quads, this is tight hamstrings, this is tight IT bands, and the like. So sorry if I'm getting a little distracted because everybody keeps coming in and I'm trying to let them all in. Hopefully we have everybody now. Okay, so we've got the full view. A lot of people like to start at the bottom, and we are going to be looking at people from the front, from the back, and from the sides, because you are going to see different things at each angle and aspect. Whoever just popped on, if you could just make sure that you are muted, that would be great. Now, I will move the computer screen closer to Shannon as we need to, but let's just start having her march in place. And just natural, couple seconds. Oh, close your eyes. Okay. Now, if your client has balance issues and they're afraid to close their eyes, that's fine. Go ahead and stop. All right. So what I want now is for Shannon to stand as still as possible. If she ends up having to move, then I will simply ask her to march in place again. Okay? It's not a big deal. So what I'd like you guys to do, and I'm going to be kind of monitoring the screen here, I want you to take a look. Let's start at the feet. And hopefully you guys can see all right. When you are looking for both feet to be going straight forward. So what is the first thing you see? And you can pop it in the chat box, or if you want to unmute, as long as everybody's not unmuting at once, that could be a way to do it also. But what do you see when you look at her feet? Okay, yes, the right foot is a little, wait, I think it's the left foot. This one. Shannon, put your left hand up. Okay, so I think that's the foot you're looking at. I don't know, that's what I see. Okay, so slightly turned out, absolutely. Now, so if you're the trainer, I would be asking my client's partner, spouse, friend, whoever, to bring this up closer so you can get a better look. All right, so once again, now you can see how this foot is turned out. What can you see as far as the arches? No, Kaya, you go lay down. All right, you guys, you just have to have a laugh. If that doesn't make your day, I don't know what does. Kaya, go lay down. All right, what do you guys see at the ankle and at the arches? Okay, can you see her arch? High arch, okay, not so well. All right, and that's okay. I mean, it's not always going to be perfect. So, and we have pretty good lighting in here. All right, well, the one thing we know we see for sure is that right foot is turned out. Left, I'm sorry. Okay, Shannon, can you pull your pants up over your knees? All right, so we're moving along here. Okay, so Kaya, hold on one second, guys. Up here, stay. This is the joy of doing this from home. All right, let's look at the knees. So look at the patella and look at the bottom of the patella, look at the top of the patella, look to see if it's centered. Look at these lines here. What do you see, guys? Do they look level? Now, Shannon, do you want to come up a little bit closer? Maybe they'll, okay, good. How's that? Is that better, you guys? Okay, patella does not track toes. What else? Do they look even? Okay, which one looks elevated? Okay, very slightly, yeah. So the left one's a little bit higher. But yeah, I think, okay, so this being the left, I think the left one looks more medially rotated, and we'll be able to see that when we do a squat test as well. Sorry, this is so hard looking at you guys and looking and her being that way. Okay, slight forward rotation of right. That's my right. Okay, We need to put stickers on him. Okay, so you guys also, here, people keep coming into the waiting room. Hold on a second. All right, so I'm looking at the ankles. I'm looking at the knees. I'm looking at the feet. And this is my front view, okay? The next thing I want to do, and when you're doing this virtually, you're going to have to cue your client. So Shannon, what I want you to do is find the crests of your hips. Now in person, that's easy for me. I come in and I palpate here. But what I'm going to need is for her to level her fingers out as much as possible so that you guys are getting the view of where her fingers are at. Okay, so can you move your front fingers out of the way so we just see, so do like this. Okay, and it's going to be this awkward doing it virtually, you guys. I mean, it's not just a matter of you being good at it because you're telling your client what to do. So they have to follow your instructions, and you know, it's one and done. You're not going to be doing this over and over with them. You're going to be on to the next person and explaining it to them as well. So Shannon, you can actually look also in the camera and try and keep your fingers level. All right, so hips seem fairly level. Yeah, they do. I mean, if I could draw a straight line from one side to the next. So that's what we're looking for. I mean, ultimately, we want everything to be level. Okay, so just doing the front view right now. Shannon, go ahead and march in place again, just to let your arms hang down, normal. Okay, so let's hone in now on her upper body. And you know, you can ask your client to like put their hair up or move their hair back. Let's look at, okay, can you guys all make sure you're on mute? I'm getting a request that there's some background noise. So everybody make sure you're on mute. So what I want you to look at is her fingers, her shoulders, her chin, her ears. Again, looking to see that everything is level. So does anybody have any observations? Okay, hands face backwards slightly. Yeah, so Barb, what does that mean? Okay, so let's focus on this hands facing backward thing because I've got a couple people. Okay, guys, make sure you're muted because I'm still hearing background noise. Please, pretty please. Okay, so you guys are saying the hands seem level more or less, palms are facing slightly backward. So I'm still waiting for somebody to tell me, what does that mean when the palms are facing backward? Okay, rounded shoulders, protracted shoulders. So take a look. If I were to retract her shoulder, I mean, yes, her arms go out to the side, but also notice that the palms are no longer facing backwards. Now they're more facing the body. So usually this is an indicator when you see somebody's palms facing backward like that, that's usually a telltale sign that somebody's got protracted shoulders, rounded shoulders. Now we can share your story, right?
Yeah.
So Shannon is a breast cancer survivor and she has had bilateral mastectomies and bilateral reconstruction with implants. And she's done a phenomenal job with her recovery, but nonetheless, you know, even for the trained professional, personal trainer, you know, what have you, who knows what they're doing, you still have a buildup of scar tissue and of adhesions that needs to constantly be worked. So even if your client, you know, has perfect posture for a while, you want to make sure that they continue to do the stretches because it can, just like muscle memory, it's almost like there's a scar tissue memory and it wants to go back. That's also guarded position after somebody's had, you know, breast cancer, mastectomy. Okay, so let's before we go on, just focus on the chest. So if her shoulders are rounded forward, what do we need to do to correct that? I'm not going to say too much. I'm going to see what you guys come up with. What exercises can correct it? And if, like I said, if you'd rather not type and you want to unmute yourself, that may be the easier way to do it, or raise your hand and then unmute. Okay, strengthen the back, expand the chest. Yeah, Nikki, absolutely. So reciprocal inhibition. if Shannon, go ahead and put your arms behind your head like this and squeeze your shoulder blades together. So as she's isometrically contracting her back muscles, right, automatically she is stretching her chest. So that's the reciprocal inhibition. So you guys, yeah, you're knocking the strengthen the rhomboids, strengthen the posterior rotator cuff. Absolutely. So simultaneously, even in an isometric contraction such as this, she can think about squeezing a tennis ball between her shoulder blades. She's getting a better stretch in the chest, and then she's strengthening posteriorly. Go ahead and relax, shake it out. Now, keep in mind also, you know, when you're doing these things with your client, I mean, Shannon's a pro at this, but a lot of people are going to have a hard time holding their arms up. So certain things that you're asking them to do may not be doable, and you may have to modify it. So, you know, I could have asked her to just do something like this if she could not get her arms back there. All right, so we got the upper cross. Let's look at the chin. Now, the lighting is not perfect, but if you were to draw a plumb line, so a line straight down the center of her body, from the middle of the chin through her umbilicus down to her, you know, through her pubic area, does it look like everything is even, symmetrical? Or is her head rotated? Is her chin tilted? Turned to her right. Okay, I see that slightly, yes. Okay, does everybody see that? Now, Shannon, do you happen, I mean, you're right-handed, right? Mm-hmm. So you probably tend to do everything on this side, from carrying your purse to...
No, my purse is carrying.
Okay, purse on the, oh, okay. And you didn't have lymph nodes removed, did you?
Yeah, the side.
And you carry your purse on the left?
Mm-hmm.
Mm. Okay, so because she had lymph nodes removed on the left, I'm going to throw something at you. Because she had lymph nodes removed on the left, what do you guys need to do? As this is an overall question, what does that tell you? You know this client had lymph nodes removed on her left. Okay, lymph drainage exercises, yes. And there's a specific thing that you cannot do. Do you remember what it is? Think about the lymphedema, ways to prevent lymphedema. I won't, restriction, okay. And so definitely no wrapping bands, but Barb, what other way might you restrict flow on that arm? What is something that a fitness professional may be doing as part of the intake that would be contraindicated on that left arm? I'll let you think about that for a minute. And let's look at her earlobes. Do you notice her big shiny diamonds? But can you tell? Okay. Okay, you guys are still putting no resistance training. Okay, I'm going to come back to that, so hold your thoughts. But I don't know if you guys are as confused with left and right as I am. Here is the right. Here is the left. So which earlobe appears higher or lower? This is fun, isn't it? Okay, yes, I agree that the left is lower and the right is higher. All right, so as you're noting these things, think about which muscles may be involved, either being shortened or lengthened. Going back to the question about what you should avoid on her left arm, it would be taking blood pressure. You do not want to take blood pressure on the side where lymph nodes were removed or irradiated. So kind of a trick question there.
Or take blood from them.
Yeah, well, Shannon says, or take blood, which hopefully you guys aren't doing. But yes, the patient should be telling their doctors, don't take. Yes, that is forever. Because remember, Lori, the risk of lymphedema is forever. Although it may, wane over time, we want to take those precautions. And, it's very simple. Just take blood pressure on the other side. Just don't wrap bands around the affected part of the body. But think about, as you guys are learning this, you may have known quite a bit, but there's probably a lot you don't know. And so think about how difficult it is for cancer patients trying to either begin an exercise program or resume one, and they really don't have any idea about all of these parameters. So you can see how they could do more harm than good in the process. Okay, so back to the ears. Oops, hold on, let me look at what you're saying, Kelly. It's almost like I need somebody to monitor the chat box. If lymph nodes on both sides, do you have one arm for blood work? So Kelly, great question. If there are lymph nodes removed on both sides, they're gonna wanna have their blood pressure taken on their leg. If you don't have a leg cuff, just have them, you know, when they go to their doctor, just make sure the doctor is doing it. So yeah, Barb put in femoral artery. Okay, so I know we're all over the place here, and that's just how this is. We're like back and forth and formulating in our heads as we're doing this postural assessment. So looking at her hands, looking at her ears, see, in my opinion, her shoulders look pretty level. Tell me if you guys disagree, because I have a kind of a thwarted angle here. Okay, so if her shoulders are level and we are seeing a difference in the ears, okay, what do you think may be going on perhaps in her neck muscles, upper trap? What might be contributing to that? Okay, so right sternocleidoid, mastoid, and scalenes. Well, the right side is lengthened, so I would say the left side, that these muscles are probably tighter, which would be pulling into lateral flexion. Okay, so what is a way that somebody can get rid of that or minimize it? Well, part of the lymph drainage exercises are neck stretches, so we could have her put her arm behind her back, gently take her hand here and just think about depressing down here to open up this area. Okay, I've got to look at the chat box again because you guys are writing them while I'm over there. So, okay, so neck stretches, right side tighter, compensation. All right, so we're all pretty much seeing the same thing. Now, what I'm going to do is I'm going to have Shannon turn around and march in place again because we want to get her standing naturally. And we're going to look at all of this from the back and see. And this time I'm going to go from the top down, okay? So go ahead, Shannon. I'm going to move her hair. Okay, go ahead and relax. All right, so you guys may or may not be able to see. I want you to look at her neck. So in this worst case scenario where this is the lighting, you can't control anything, what do you guys notice in her cervical area? Now, I could zoom in here. I don't know that that's any better. Okay, so it seems that we've got some forward head, which when we look from the side, we will be able to see that probably from a better perspective. But if you move her hair out of the way, you know, it's hard. And I'm holding the computer and I'm moving her hair, so I'm afraid I'm going to drop the computer. Or there, if you just do that, that's great. Okay, so you see just a little bit right in here. Okay, all right, so go ahead and relax again, Shannon. And each time, just like I'm telling her, this couldn't be any more real for you. This is exactly what it's going to be like when you're doing this virtually. Okay, so looking at the shoulders now, do we see a difference in the shoulder height? Okay, so this is the left shoulder. This is the right shoulder. So which side is higher or lower? Left, right. Okay, it's funny because you guys are all seeing different things, but the right side appears lower. Okay, so hopefully you guys are all seeing that same thing. All right, so what could be contributing to that right side being lower? Now look, this is interesting because turn her around. This was the side that you know, this was tight. So what's the opposite? If we're looking, you know, at opposing sides, this side is dropping lower. So what could she do to level out her shoulders? Any ideas? Okay, strengthening our right side. Any particular exercise? Rotation, you mean like external rotation? Shoulder press. Okay, so shoulder press. here's the thing, and this is just my personal opinion with shoulder. Well, it's not really just my personal opinion, but anytime you're doing overhead movements, you know, the shoulder is one of the most overused joints. And so we have a lot of injuries in the shoulder. And so as a trainer who errs on the side of conservative, I avoid overhead presses like so, unless there's a sports specific reason to be doing those, like somebody's a basketball player, a volleyball player, whatever. Otherwise, I might do something like a modified, like an Arnold press or something, which is going to work the entire deltoid, but without that overhead, because as soon as we go from here up, we have the potential for shoulder impingement, which a lot of people have. And when we're dealing with people recovering from breast cancer surgery, many of them are going to have limited range of motion anyway. So first, of course, we're going to work on range of motion, and then try something like, you know, a modified, like an Arnold press or something. That would be my recommendation. All right, let me check the chat box real quick here. Okay, so use adduction. Now, one of you is saying adduction exercises, ADD, and one of you is saying abduction exercises. But I'd like to know what your thought is on that when it comes to the shoulders. Now, if I hold her hair up, can you guys look at her ears from this perspective as well? You know, so when we looked from the front, we saw that one appeared higher than the other. Do we see the same thing from the back? We'll let you guys think about that one. So here, can you hold your hair up? All right, and hopefully you guys are following me. Okay, so the right one a little bit lower. Yeah, we're seeing the same thing. All right, now what I want you to do is right where her cancer exercise specialist is. Now, if it were in person, we'd come here and we'd palpate the spine, and then we can look at the inferior angle of the scapula on each side, trying to stay out of your way, and see what the distance is to the spine. Okay, and so I'm seeing they're pretty much equidistant, but you're not going to be able to do this virtually. There's no physical way unless you have somebody here palpating for you. Right? Okay, Joyce, you just put in the ear. I just saw that. Okay, so unless you have somebody who can actually feel that inferior angle of the scapula, comparing it to the spine, there's no way you can eyeball this. And same thing with winged scapula. Now, I don't know if you guys can see the winging here. Okay, it's very subtle. Whereas in person, I can actually grab her scapula. Okay, and I can do that on both sides. So depending on the severity of it, I would classify this as slight, moderate, or severe. And at the end of your Module 4 handbook, there are forms, one of which is an assessment form, and you just go through and you just fill it out. You know, forward head, yes, no, slight, moderate, severe, rounded shoulders, so on and so forth. So I would say winged scapula, left and right, slightly. Now, I don't know if any of you can see, because I certainly can't just visually come to any conclusion there. I had to actually palpate and touch. So if her husband was here, I could say, hey, Todd, can you go over there and will you just kind of try and grab her shoulder blade? And if he could do so, that would indicate to me that there was some winged scapula. So Barb, you're not allowed to answer this. Does anybody know with breast cancer, somebody has winged scapula? What might be causing that winged scapula? Now there's two answers. One is a procedure and the other is the actual muscle imbalance. So you can answer one or both. You doing okay? Just standing there looking at a wall. Don't you feel like a little kid in the naughty seat? All right, damage to the long thoracic nerve. Excellent, Tracy. Awesome. So damage to the long thoracic nerve, which is usually from an axillary node dissection. What does that do to what muscle? Okay, so if there is damage, okay, weakness to the serratus anterior, absolutely. So it can actually cause a temporary ceasefire to the serratus. So when you look at your chart and you look and it says, you know, muscle imbalances, it'll say winged scapula. and you're going to look, it's going to say probable weak muscles, and it's going to say serratus. And then when it says probable tight muscles, Tracy, do you know what the answer to that is? What is the opposing muscle that is probably shortened and tight? Okay, while I'm waiting for the answer, just know that Shannon did not have an axillary node dissection. So one, that's not the cause of her wing scapula. And two, it's bilateral on her. So yes, the opposing muscle group is the rhomboids. So often we have tight rhomboids and weak or non-firing serratus muscles. So regardless of whether this is from an axillary lymph node dissection or just everyday life, if we find somebody who has wing scapula, we know they need to strengthen the serratus and they need to stretch the rhomboids. So as you're flipping through your manuals, you'll go a few more pages and you're gonna have sample exercises. Here's a rhomboid stretch. Here's a serratus strengthening exercise. So you can think of others that are similar, if you wanna use yoga, Pilates, what have you, but look at the movement pattern and try and imitate that. So in this one, she would be lying supine, doing something like this, like a ceiling punch. Or she could be doing wall push-ups where you do like a cat back at the end. Now, think about some other exercises that you could do for the serratus. A lot of people will say things, like a plank, or, a straight arm plank, or holding a ball with both hands. But then think of your clientele. And if this is somebody who just had a mastectomy and reconstruction, we don't want to do that. We don't want to use an unstable surface like that. But also, what is this doing if they're holding their weight like in a plank or on a ball? Even though lying supine, this is an effective motion, when they're weight bearing on that area, what are they doing here? They're shortening and tightening the chest muscles isometrically. So be really careful. While there are many benefits to something like a plank, it can be more detrimental, especially if somebody has upper cross syndrome and shoulder instability. Okay, emphasizing, hold on, Nikki, I gotta open this up to read what you're writing. Emphasizing the weakness through the chest. So yeah, so here's the deal. The chest can be tight and also weak. It doesn't go hand in hand necessarily, because if they're not using their chest muscles, there probably is atrophy. They probably are weakening. But what I would want to do is something like a chest fly, which is still going to stimulate at least the pec minor, right? But we're opening up the chest as opposed to shortening it. So Shannon, you can turn around for a second just so you don't have to keep looking at a wall. We'll make it. So Shannon was told straight up by her plastic surgeon, no push-ups, right? I mean, you tell him exactly what he said. I mean, did he say no chest work at all?
He said there's no need for you to do chest work.
So for her, I mean, he's telling her, you don't need to do push-ups. You don't need to do chest presses. Every doctor may have a different opinion. The bottom line is you guys are going to take whatever their doctor's advice is. So if Shannon's surgeon told her no chest work, then it doesn't matter if I think she should or she shouldn't. I am not going to have her do it, because if you want to put yourself in a real legal pickle, go ahead and contradict a doctor. You'll be out of work. So, whether you agree or disagree, you do what the doctor says. Now, there are people who, after they've completely recovered, will want to do push-ups, will want to do chest presses. And while I might discourage it, maybe they're doing it on their own time, or they're at least balancing it with more back work. So yes, Michelle's saying she can stretch. So Shannon, what are a couple chest stretches you could do if you were showing your client? We did the one with your hands behind your head, okay? Just simply like the bird. It's an isometric retraction of her shoulder blades, and because of reciprocal inhibition, her chest is stretching. Yeah, sorry, the door is locked. We forgot the key. So here, do it over here in the corner. Okay, she can do like a corner stretch.
This is my favorite.
Okay, and notice how her arm is slightly lower than shoulder height, because as I said with the shoulder press, as soon as we go above or even equal to shoulder height, and she could, if she wanted, she could come up a little bit more. Whoops, there we go. But oftentimes this is where people are getting impingement, and I'll have them lower their arm in order to do it. And I want her to hold that stretch like 20 to 30 seconds. So all of these things, these different stretches and exercises are in your books. We're just kind of showing you live so you can put it together with, okay, if you see this, what exercises should you be doing? All right, so let's flip you around again, march in place. Now I'm gonna have her poke her iliac crest again with, if you can just do a single finger, Shannon, so they can see whether they're level. So from the front, we decided that they looked level. Okay, and they still look level from the back, wouldn't you agree? Actually, let's make sure you're doing it. So get right in there on top of the bone. Okay. All right, how's that look, you guys? Pretty level, yeah? All right, and obviously if I was doing this virtually, I can't go over there and poke, so I'm just gonna have to rely on her. All right, go ahead and relax if you'd like. Now take a look at the backs of her knees. Do the lines in her knees look level? Do we see any hyperextension? Okay, what do you see, Nikki? Okay, and while you're looking at the knees, you can also start to go down to the ankles and the feet. And tell me what you see. Gotta open up. Okay, right knee, so meaning this side you're seeing higher. From where I'm at, it's pretty level. Now also, you guys, if it's something that is like so minimal, don't even worry about it. I mean, unless it's pretty obvious, if you're, nitpicking with a microscope, I wouldn't worry about it too much. So I see more issues down at her feet. Let's go ahead and roll on down to her feet and tell me what you guys see. So look at, okay, so the right foot, which one's turned out? Okay, the right foot slightly turned out. Actually, it's so funny. Okay, so this is the one that I see turned out, which is her left one. a little bit on the right. Okay. All right, what else do you see? Look at the Achilles tendons in through here. Do they look lined up properly? Take a peek down there. Okay, now I can't really see what's going on with the right arch or left arch. Wait. Shannon, hold up your left hand with that side. But it definitely looks like the other side is pronating. It is falling in. Would you guys agree? Okay, so once again, you can go to that chart in your book and you look up excessive pronation, excessive supination, and it's going to tell you these muscles are tight, these muscles are weak. So when somebody is pronated, okay, and the emphasis is inward, they are likely to have stress injuries on their big toe and the second toe because all the pressure is rotating inward. And what does that do to the knees? If the ankle's rotating inward, what do we often see with the knees? Because remember, everything's connected. It's all working together. So Shannon, do me a favor, force your left foot to turn in even more, like rolling in, okay, like this. Okay, I don't want to hurt you. So if her foot rolls in, what is happening to the knee? Good, relax. Yeah, knock knee, right? They're rolling in. So we have improper tracking in the patella. And we did see that one knee was medially rotated when she was just standing in place facing us. So we'll do a little squat test and we'll be able to see more from that. What about at the ankle? Which muscles do you think, or the lower leg, which muscles are tight, which muscles are weak, generally speaking? Any ideas on that? So if we're rolling inward, it's safe to say that this is stretched out and this is shortened, like the peroneal area. Okay, and what about the gastroc and the soleus? What role do the anterior or posterior tibialis play in that. So probably a lot of calf stretching. Yeah, super tight. And we'll be able to also see that with the squat test, because if her heels come off of the ground. Now I think I shared, and if I didn't, I'll go back afterwards and share these. There are three videos of, it's kind of squat test part 1, 2, and 3. So we'll do a real quick thing here today, but I'll put those videos, I'll post them on the Facebook page for you guys today. Very interesting the way this guy conducts the squat test and the different things he looks for. I think you'll find it fascinating. Okay, so do we see anything else from the back, or are we ready to have her turn sideways? Okay, anybody notice anything else? Look at the elbows. Do they appear level? So everything, I mean, nobody is perfectly symmetrical. So there's always going to be slight alterations, but you know, does the heightened elbow go with the heightened shoulder? These are all the pieces that we're putting together. And it's actually, it's fun. It's like a science project. Okay, so Sheena, go ahead if you will and face the mountain. Okay, yeah, she gets a mountain view now. All right, so we are gonna have her march in place again. And now we have, let's start up here. Okay, I'm gonna grab a pen, so go ahead and just hold it in place for a second. All right, now, obviously, virtually, this is going to be a little difficult to do unless somebody can be there doing it. But in person, what I'm going to do is I'm going to go from her earlobe right down into her clavicle. So if the clavicle is like a coat hanger, I'll line my hands up here, my fingers here, and this pen should be coming down right into the center. Okay? So hers is ever so slightly forward, which we may have seen. Shannon, can you just pull your hair up off your neck for a sec? Okay, so you can see that little bit of curve there in her cervical area. Okay, we can also see that, yes, the shoulders are forward, so you can go ahead and lay your hair down. You can see the protraction here. And if her hands were like this, then it would probably be less protraction, but being like this is more protraction. All right, without using any hands or fingers, what else can you see from the side? Okay, anterior tilt, slight sway back. So how can we figure out if that is actually true? Now, your client has no idea what an anterior superior iliac spine is or a posterior superior iliac spine. So you're going to tell them to find the bony part of their hip in the front and the bony part in the lower back. And you're probably going to need to use 2 hands, just do one side. So if you're able to, find that ASIS and PSIS. And this is a task for some people. So, all right, it's very, very slightly, maybe a finger's width difference in the front than the back, which is an anterior tilt, like she's a teapot tipping over, but it's very, very slight. Okay, so if someone has, you can relax, Shannon, if somebody has an anterior pelvic tilt, which muscles are usually tight? Which muscles are usually weak? Anybody have any ideas? So somebody's got an anterior pelvic tilt. Okay, tight hip flexors, absolutely. What's the opposing muscle group that is probably weaker or overstretched? Glutes, okay? So if you were to drill a hole straight through her, now, Shannon's probably going, I don't have weak glutes. And it could be just one is weaker. Maybe the hamstrings are tighter, but I can have her lie supine. So make sure you guys, look in your books as well as watch the videos in your modules, doing a modified Thomas test and understanding what to look for. So if she has tight hip flexors when she's lying supine doing the modified Thomas test, her upper thigh should lift up off of the table because the hip flexors are shortened. So if we see that her hips are level, then we go, all right, well, maybe it's not the hip flexors, maybe it's not the glutes. Then what else might it be? What else could be causing that anterior tilt if it's not the hip flexors and glutes. I want you to think about somebody who's had an abdominal tram, okay? Weak abs, tight what? Looking at her back, if we've got shortening posteriorly, which muscle group, which muscles do you think might be shortened, tightened, and or weak? Okay, tight erectors. So we need to do the modified Thomas test to determine if it's actually hip flexors, or then if it's not, then we can go on to the assumption that it's tight lower back erectors and weak abdominal, particularly the rectus abdominis, which with an abdominal tram would now be, you know, up in the breast area. Okay, so is it, yeah, tight lats also. So Lori, think about this. What if somebody had a lat flap? You're looking at the same exact posture, but you know their lat is in their chest now. How do you think that that might change this posture? You doing okay? Mm-hmm. Practice standing straight. So somebody has a lat flap. So literally I'm detaching the lat here, tunneling it around, it's coming out as the breast. What do you think this side view is going to look like? Any guesses? Okay, yeah, a little more rounded because now we've got the pec and the lat in the front, so we don't have that support. So it becomes really important, right, to work the scapular stabilizers so that we can correct that round shoulder. And then also, you know, the lat plays a big role as far as abduction and flexion. How is that going to be impacted? Check the chat box here. Okay, yeah, rotated anterior. All right, so everybody seems to be following pretty well. And so once again, if she has tight hip flexors, weak glutes, then we stretch the hip flexors, strengthen the glutes. If she has tight low back, weak abs, then we strengthen the abs, we stretch the lower back. But in the instance where there are no rectus abdominis muscles there, then we do core work. We work the transverse abdominis, the external, internal obliques, multifida, all the spinal stabilizers. So don't focus on crunch type exercises, but they can do any other lateral moves to strengthen the other muscles. And so what is the word, what is the term when the smaller assister muscles take over the job of the primary mover? Anybody remember as I shift the view down? Okay, perfect guys, synergistic dominance, excellent. All right, now lastly, let's look at her lower body from the side. Take a look at the knees, take a look at the ankles, take a look at the feet. What do we see? Anybody have any ideas? Do we see any hyperextension in her knee? Okay, yeah, definitely still the rotation in the foot for sure. Look at the knees. You guys are just honing in on the feet, which is good, which is good. Yeah, there's not a whole lot of an arch. And that can also happen with pronation. Usually it's more of an arch with supination. Okay, but anybody see anything at the knees? I know the lighting keeps kind of shifting because of the cloud cover. Might be a little bit of hyperextension, okay? So she may have tight quads. And once again, we will see the tight quads during the modified Thomas test. So make sure that you guys include, I mean, when at all possible, postural assessment, modified Thomas test, and squat test are going to tell you a lot. Now, Shannon, do you have any knee pain?
Sometimes I have bursitis whenever it acts up. But
Okay, okay. Let's go ahead and face forward again. And let's finish this off. Maybe come up a little more in the light. That's perfect. And we're going to start with your arms up. We're going to do a squat test. So I'm going to instruct her. Actually, can we get you all in there? I'm going to instruct her to do this. Yeah, maybe you have to just to get you all in there. We're not going to get every bit of her, but mostly. I want her to stand, you know, shoulder width apart, arms raised up. We're also going to do this from several different views, okay? So what I'm going to see from the front is going to be different than what I'm going to see from the back and from the sides. So what I want you to look for when she's doing the squat test, And she's starting with her arms here. Does she hinge forward? Do her arms come out to the side? Do her arms fall forward, but she's not hinging forward? Do her knees collapse? Do they bow out? And then if you can also see her feet, let's take a look at what they're doing. Now, before she starts, we are already assuming that they are going to go inward, right? That they're going to knock knee, which would also make her feet pronate more. And possibly, if she really does have tight lats, her arms will fall forward or fall out to the side as well. All right, so let's give this a shot. So nice and slow. Okay, just do a couple of those slow. And you guys, look what's happening at the hips. Look what's happening at the knees. Let's try one more. Okay, relax for a second. Keep in mind that your client's probably not going to want to do 10 of those in a row, especially they're recovering from surgery and that type of thing. So tell me what you guys may have seen there. Did you see anything happening with the arms? Did you see anything happening at the hips, waist? Did you see anything at the knees and or the feet? And this can be a difficult view. We can see, I feel like I can see a lot more oftentimes from the side. Okay, arms slightly forward. Was it the arms, and I'm gonna have her repeat this, was it the arms or was she falling forward at the hips? So Shannon, let me focus, guys, a little bit more up here, okay? So now let's watch again. Okay, so I don't really see her arms moving at all. I see all the movement coming at the hips. Go ahead one more time if you don't mind. Yes, falling forward, Nikki. That's what I see as well. All right. So we're kind of putting these pieces together, and in that chart also, it's going to say arms fall forward during squat test, arms go out to the side during squat test. It's going to tell you which muscles are probably tight and which muscles are probably weaker. All right, I'm going to have Shannon, I guess face the mountains again. You like that view?
I do.
And let's try and get her all in here. Okay, so we're going to have to do two different views. So let me start off with the top part. So we're going to watch her back, her low back. We're going to watch, is she falling forward, Nikki, like we saw at the waist? Do her arms actually fall forward? Let me get the knees a little bit too. Okay, we definitely see that excessive curvature in her spine. Arms are not moving, yeah. Okay, a little slower, Shannon. We're moving down the body here. Do we see her heels coming off the ground?
No, always wiggling my toes.
Yeah, arms are solid. Okay, anybody notice anything else? Go ahead and relax, Shannon. All right, so we definitely see the falling forward at the hips. Let's try lumbar is hyperextending. Yes, absolutely. So could that reinforce what we're thinking with maybe weaker abs, tighter lower back, as opposed to tight hip flexors, weak glutes, perhaps? Let's try a back view, just one more. All right, I'm gonna start at the feet this time. So whenever you're ready, Shannon. Okay, look at the feet, look at the knees. Don't really see them collapsing inward too much. I see some instability. Okay, moving up. Still going forward, but no movement, so to speak, in the arms. Okay, go ahead and relax, Shannon. All right, so now here's the view of the mountains. Oh, I like that. You can relax. So what I want you guys to do, having gone through the full body now, your homework, I'm not going to post it. Well, I will post this in Facebook, but I want you to think about this, okay? Yeah, shoulders are definitely pulling her forward, Nikki. What I want you guys to do now is take these findings, and if you have to watch this recording again, you may have to. Take these findings and go into your book in the chapter on postural assessments. I want you to look at the chart where it says tight muscles, weak muscles, so on and so forth. And I want you guys to put together a workout for her. Simple, bullet points. You don't need to give me real fancy stuff because this is going to take me forever to go through. Okay, so Nikki, all the books, remember when you guys are ordering hard copies, we are ordering them on demand. Not keeping stock and whatever with the post office has been a nightmare. So they're being printed as we order them and then shipped to you. It usually takes about 2 weeks. So if you need to, check in with me and I can look and tell you exactly when they're going to be delivered. But alternatively, go to ceti.teachable.com. And I believe it's in, is it module 2 or module 3 for the assessments? I think it might be module 3. Shannon's going to go check. It's all in there, you know, on your computer. So even though you don't have the pages to flip through, go ahead. Thank you. We found it. Lori says module 3. That's what I thought because I know module 2's treatments. So go to that module 3 and look at that chart and come up with an exercise program for Shannon.
Great.
Okay. So if I saw somebody just clicked in here. So watch this webinar again if you need to. Okay. Or if you took notes while we were doing this on all of these different muscle imbalances, your homework, and this is a big deal, guys, because this, for those of you who've never done this before, don't hesitate to reach out to me for additional assistance, but watch the videos in your Teachable module 3 first, because you know there's lots of supporting videos there that might be clearer, the lighting's better and such. The purpose for doing it like this is because this is what it's like right now with COVID, and you're not going to have the lighting perfect with the photographer there. But you can watch the perfectly filmed one in your Teachable account. Then go through, put together a workout. What's this? Wouldn't you do view from mountain, not mountainside? I'm not sure what that means, but normally I wouldn't have the light coming in on this way, but I just wanted to sit down while I was talking to you.
Wouldn't you do it from the right side and from the left side?
Yes. In real life, we would do.
You would have turned it around. Okay, thanks. I can't type. Sorry.
Yeah.
Thanks.
So both sides, front and back. Okay, and that's why I'm saying, like, also watch this not the webinar, watch the recorded video that's in your module 3, and then go ahead and what's the easiest way to do it? I guess go ahead and post your answer in the Facebook where I'm going to put it. So I'm going to put the recording of today in the unit section, and I'll post this one homework, which is to do her workout program, and then you guys can answer it right there. Now, obviously, one person can copy off of the other person, can copy off of the other person, but you're not going to learn that way. So if you're looking to what other people are writing because you have questions yourself, that's fine. But then try to pick different exercises based on what that other person chose, or based on, you know, what it is you're trying to correct. Okay, so does anybody have any questions? I know there were people clicking on the whole time, so I'm sure people came in midway. Shall we assume that the drainage exercises are done? So having nothing to do with the postural assessment, Nikki, because we know that she had the lymph nodes removed, yes, she will be doing upper extremity lymph drainage exercises, and you'll have to take all the considerations for lymphedema. That includes starting and progressing slowly, giving her all the, you know, the ways to prevent lymphedema, just call it lymphedema precautions, taking the initial baseline measurements, monitoring for swelling, teaching her about pitting. Okay, so that's going to be 5 minutes of cardio, and then that's probably your first 15 minutes. So let's finish off the case scenario with Shannon has been working out since her surgery. Her surgery was 3 years ago. Okay, so just using that as a parameter.
Today.
Yeah, it's her
3 years today.
3 year. What do you call it? A birthday?
Cancer-free versary.
Cancer-free versary. So congratulations to Shannon. Perfect timing. And so she has done a lot of work, as you can see. This is not somebody you have to treat with total kid gloves because they have been active, but they happen to be coming to you.
Reese's peanut butter cups.
If you guys are missing this stuff that Barb's writing, we were all out here last year, and we're in Vail, Colorado, and we tried this peanut butter whiskey, which literally tastes like peanut butter. So yesterday I found chocolate whiskey and took a picture of the two sisters, and so Barb's making jokes about that in case you have no clue what she's talking about. Okay, so if anybody have any questions, remember, this is not perfect. In fact, I would look at this and like go, oh God, that's awful, but this is the best we can do right now virtually. watch the one that's recorded in your module 3, where I'm actually conducting a postural assessment with perfect lighting and what have you to see the difference. And that's what you will do, in real life. But you're going to go to, give me probably an hour before this recording goes up. I know you guys are like, oh yeah, I want to do this case study now, right now. This is what's part of your grade, if you will. While you're taking a multiple choice exam at the end, this is how we can determine if you're really understanding this information. So bilateral mastectomy, lymph nodes removed, left side, no chemo, no radiation, no hormonal therapy. Has been exercising for 3 years. You saw her postural assessment, her squat test. Let's just assume, if we had done the other side, it would have looked identical. She's pretty symmetrical. And then you're going to go and you are going to put together a workout. Try and keep it real simple, bullet points. Please don't write paragraphs. I know you don't want to type all those words and I don't want to read them all. So let's keep it simple for all of us. And if you have any questions along the way, just shoot me an email at andrea@thecancerspecialist.com. All right, so I don't see any questions. Thank you guys for being here. I think Dan's webinar is now rescheduled for tomorrow. I will post that link as well. And then we are working on the schedule for your study times. So hopefully you're progressing nicely throughout the modules, and just let us know if you need any help. That's what we're here for. Shannon also, she runs the business mastermind and what's the new program, the ABC?
Yeah, the accelerated business course.
So we have an accelerated business course. It's a 3-week course, and she takes you through launching social media and building your business. So like out from the gate, you got your certification, you're ready to go. And then she teaches the ongoing mastermind as well. So just wanted to put the name with the face and the job title. All right. Thank you guys for being here. Appreciate it. Have a wonderful day. And yes, Bar, we will. And we'll talk to you soon. Okay.
Have a great day.
Bye.